So as you heard, my name is Keith Burk. I'm from Canada. I want to thank each and every one of you for joining us this morning and allowing me the opportunity to join you to learn. Because basically in medicine, we never stop learning. We know that. And every opportunity, whether we're standing here or sitting there, is a learning opportunity. So today we're going to talk about Scarlet. You're going to hear a lot about Scarlet. It's very exciting technology. I believe what's amazing about Scarlet is the word solution. We're always looking for solutions in medicine. Solutions to problems is really the existence of what we do. And I believe that any device that we bring into our practice, any device, in fact, any therapy we bring into our practice, needs to fulfill 3 criteria, and only 3 criteria. The first is it has to be safe, right? We can't do any harm. The second, and I believe they should be in this order, it needs to be effective. And the third is it needs to give us an ROI, or return on investment. We are in business, so we can't buy a device and it not actually return revenue to our practice. It just doesn't work. I understand that needs and wants aren't the same thing. And therefore you may say to me, Keith, okay, respectively, but I'm running a business, so I want return on investment to be number 1. To which I would respond, I accept that. I understand that in my practice as well. But what I will say to you, if a device isn't safe, it means your adverse events are going to go up. And we've all had adverse events and had to manage them, okay? They erode our return on investment. We are working basically for free to basically overcome the adverse event that we cause. So that erodes ROI if it's not safe. If it's not effective, the patient is not impressed with the outcome. And basically, if they're not impressed with the outcome, they might give us a bad rating or review, but more importantly, they may not come back for a second treatment. So again, safety, effectiveness, and then return on investment, I think, are the needs of every device that comes into our practice. This is my disclosure slide. It also shows you how I spend my time in Canada. I wear a lot of different hats, and I really enjoy the diversity of that. And the first question that I want to ask is, really, why are we here? And I don't mean this in a metaphorical way. I mean this literally, why are we here? Well, I believe one of the reasons that we're here is that we all share a trait in common, every one of us. And that trait is that we're all convergent thinkers. And so you go, okay, I'm not really sure what that maybe means. Well, what we know convergent thinking as is we're problem solvers. And the people in this room problem solve at a very, very high level. We don't just solve our problems and our family's problems. We solve patients' problems multiple times a day. In fact, sometimes we solve multiple problems in one patient in a day. We all know those patients. And we do it at a very dominant level. And I would say that each and every one of you today gave up something. You gave up time in your office, revenue. You might have given up another engagement to come here basically to learn how to better solve problems. In this day and age where the world is basically drowning in narcissism and fueled by social media, I think that is incredibly impressive, and I think we need more people who are convergent thinkers, problem solvers. And I'd like you to just take a minute and be very, very proud of the fact that this is what you do, because the world needs us. The world needs problem solvers now, probably more than ever. So on to the topic at hand, we're going to talk about the foundation, the historical precedent of the technology that we're talking about today. Microneedling has been around for a long time. It was first described in 1905 by a German dermatologist. And they actually named this collagen induction therapy, which is pretty cool, right? That they understood at that time that by making little tiny puncture wounds, the body would heal by making more collagen. It's very clever. It was also the first fractional treatment that we know. Fractional treatments are very common in our profession now. And basically that's meaning you don't treat the entire target area, you treat a fraction of the target area and you allow the surrounding tissue to heal it in. Another brilliant technology. Why? Because it's incredibly safe. And microneedling is incredibly safe. But it has downsides. The main downside is it's not that robust. People can microneedle at home, but you have to do it a lot of times because you're treating maybe 5% of the target tissue. Radio frequency energy has been around for a long, long time. And we live in a sea of RF energy, right? Cell phones, TVs, radios, radar, it basically surrounds us. And therefore, we probably feel that it's relatively safe. It better be safe because we're surrounded by it. So it's ubiquitous in its nature, it's electromagnetic, it's actually in a range of somewhere between 3 kilohertz and 300 gigahertz. I can't even comprehend that sort of wavelength. It's incredibly fast. And it's been used in medicine for over 75 years. Again, I believe it's a very, very good technology because the one nice thing about radio frequency, unlike laser, it's oblivious to color, right? It doesn't see chromophores. So it treats all tissue the same. But one of its downsides is that the way we've traditionally used RF, and I loved RF in my practice, is we treat it on the surface. So we need a lot of energy to drive that energy down into the skin. It doesn't penetrate very deep, about 3 millimeters. And there's a thing called the skin effect. What it likes to do is concentrate along the surface when it conducts. So in essence, what we're doing with traditional RF is we're heating the surface. So, two great technologies, very, very safe, but their effectiveness had limitations. So along came some very brilliant minds, and they were brilliant minds, and they took two very safe devices, radio frequency and microneedling, and they added them together to basically create RF microneedling. And so what happened was we kept the safety of both modalities, okay? We're able to heat the skin with RF, and we'll see later the temperature we're heating it to is around 40 to 60 degrees, and I'll show you exactly why that's important, and it is important. Less doesn't work, and more is quite dangerous. Microneedling allows us to drop the needle into the target tissue, and make no mistakes, our target tissue in all the skin is essentially the dermis. And we'll talk about that a lot today. And we actually do it in a safe manner. We do it fractionally, so we don't treat the entire target. We treat a small portion of the target, allowing normal skin to heal in, keeps us from having adverse events. And then this simple but yet brilliant technology of RF microneedling is created from adding these two together. Again, a brilliant idea. So RF energy is, in simpler terms, is electric energy. It's electric energy that moves back and forth in a wave-type pattern. And so when it meets a resistive substance like tissue, that electric energy turns into heat energy. And when you consider that 60% of our skin or tissue is water, in essence, what we're doing, as this animation shows, is we're heating water. We're boiling or bringing the temperature of the water up to affect a change. So very simple. We're not doing anything overly creative, but even when we generate that heat in tissue, we must have control over it, right? Because you see, if you look at the different temperatures, lower temperatures around 40. Under 40, we're probably not doing much to the tissue. We're causing a little discomfort, but we're not changing anything. Around 42, we start to make the cells release cytokines, growth factors. So that's kind of cool, because if you think of things like PRP, that's basically what we're relying upon. So at lower temperatures, and this you'll see in the talks later on alopecia, is probably the area we want to play in when we're stimulating tissue, when we're stimulating hair follicles. Then as we actually climb up to 50, 60, we're starting to create coagulation. Coagulation is damage, but not enough damage that the body can't repair it. Critically important. We're controlling that heat energy. The other thing that's interesting is down around 40 degrees, there is a cell in the body that doesn't like heat at all, and that's fat cells. And basically, we know that everybody wants to get rid of some fat cells somewhere. So that's an important thing to note, because I believe that's another target with this device that we can utilize, and I have in my practice utilized it. When you actually get over 60 degrees, then you actually run the risk of actually damaging cells to the point of killing them. We don't really want to do that. We want to denature them, we want to change them, but we don't want to actually destroy them. And then when you get up around 100, well, you're just nuking the tissue, you're vaporizing it. And when you think of what we've used for years, what surgeons use, every time they're in the OR, electrocoagulation or ablative therapy, in essence, you're nuking that tissue. Again, as we just discussed, this is really the principles of that whole heat and controlling heat. So basically, there's a concept of impedance, and impedance is just simply the resistance to flow of energy. And tissue offers impedance at different levels, okay? So if impedance is high, then conduction is low. And so reversely, if impedance is low, conduction is high. And how does that translate into the body? Well, tissues like blood and wet skin. Remember, all skin underneath this, the stratum epithelium, is relatively wet, it has water in it. They'll actually conduct, which is a beneficial thing and something that we just need to be aware of. And then when you're looking at bone and fat, as I mentioned earlier, they actually have a high impedance, so they don't conduct. So if you're not conducting, you're holding all the energy, you're not moving it on down the road. And you can see that's probably one of the reasons that fat is fairly heat sensitive. And we look again, we're treating anywhere between a range of 40 and 60 degrees Celsius. And when we heat around 40 to 50 degrees, then what we're doing is we're damaging the tissue a bit so that it has to repair itself. When we go to 50 and 60, then we're coagulating, and then we need to regenerate tissue. Both things we can use to heal, because they're both kind of aspects of wound healing. Right now, as in medicine and for years, there's different ways that we can deliver RF. And I'm not going to belabor this point because we know the way that this device delivers, but basically we talked about bulk heating at the surface with RF, and I have Syneron devices which use RF in my office. We don't use them anymore, but I like them, they were great. But they were bulk heating at the surface, and we know that limitation. It doesn't go very deep. And I'm really treating the skin more than I'm treating the dermis. The dermis is our target. So what did I have to do? Well, I have to put cooling devices on the skin because I'm heating it too much. That gets a little dangerous. We can do monopolar, which is basically, in medicine, that's ablative kind of coagulation treatments. That requires, we have to ground the patient. So we used to have to put a ground pad on the thigh. We're maybe treating the shoulder. Well, electricity flows, it conducts. That means from where we were giving the electricity monopolar, it has to exit through basically the thigh, meaning energy travels through everything in between. Is that a great idea? Well, we don't want it traveling anywhere near the heart, so we're not sure that that's entirely safe. So bipolar just actually goes a shorter distance between the two poles of an electrode, so we can now safely target the tissue that we want to treat. Insulated and non-insulated. Well, we're going to learn, Dr. Na discovered that what was intuitive, that an insulated needle had to be better, right? I mean, we're insulating part of the needle, and so we're going to protect the skin. Intuitively, we'd all put our hand up and say it has to be better. Well, his brilliant mind, through experimentation in 2015, discovered that, yeah, that's not the case. And we'll see a little bit later that if we control the time, again, I love the word control in medicine, and basically deliver it for a defined period of time, that it turns out, no, non-insulated is actually a superior way to treat. And then, again, we're at the hertz. That's basically how fast that wave is moving. And it turns out that if we use 2 million hertz, some companies use 1 million hertz, 2 million hertz is a more efficient, more controllable way to heat the tissue. So some of the main features of the Scarlet, the Na effect, I'm going to go into that in more detail in a later slide. But again, it's the principle of using 2 megahertz bipolar RF energy through non-insulated needles for a very defined period of time to heat the tissue to our target temperature. And it's a very safe way to do it. Control. Who doesn't want more control in their life? All right? I didn't have control over my flights getting down here. It was very stressful for me. We all are the same. Control is important. I think control for physicians is extremely important. And so this device beautifully and simplistically allows us to control, which increases safety and increases versatility. We can control the speed, FB and L. You can call them FB and L. I like to say it's 100 milliseconds, 200 milliseconds, 300 milliseconds. Simple. I like things to be simple. So we can control how long we want that energy to go into the tissue. We can control the depth from 0.5 to 3 millimeters. Well, if our target tissue is the dermis, That covers it all. We actually means we can get into the papillary dermis, and we can go well past the dermis, and I show you in later this afternoon some slides on that. And control from a depth is critically important. No longer do we have to worry about the epidermis of the surface. We're going to control exactly where we deposit that energy. We have 10 power settings that we can use, and then for our convenience, we can even speed it up. So we have a lot of control in this device. And then what's very important to us, this device has been tested. This device has been tested in clinical trials. I believe there's over 10 on this particular device, 20 on all the devices that the company has. And then this device has been used worldwide, right? I'm from Canada using it, you're in Mexico, all around the world. And so it's peer-reviewed, meaning we've used it, we've experienced it, we've reported any adverse events that we've seen, and that's what a peer-review technology is. So safety, it covers that. The Na effect, we talked about before, that was 2015. And Dr. Jungju Na, he's an MD, PhD. I like to call that a double doctor. Obviously a very brilliant mind. I've had the privilege of meeting him on several occasions. And what he did is he actually stepped outside the box, which is where all scientific discoveries tend to occur. And he thought, okay, I get insulated needles should be good, but I want to play around with a non-insulated needle. Well, one of the reasons you'd want to do that is you have a little bit more control over conduction. So a scientist would like that. But what he discovered, and you can see it pictorially, and many of you have probably seen the video that shows the tissue changing, but if you, sorry, I don't have a pointer, if you gently heat the tissue up to 0.3 seconds, 300 milliseconds, it's a very short period of time, then what you get is a very controlled heating of the tissue and a very controlled coagulation in a conical shape, meaning it's wide at the bottom where we want our target to be. That's exactly where we set our device to end. And then it actually tapers off to way less energy, just a fraction at the top. So basically it's safe and effective and gives a better treatment result than insulated needles. And we'll talk about that concept more and throughout the next 2 days. So physics of it is that energy is simply power, which we can control, set times time. That's how much energy we're putting in the tissue. So mathematically, when we set our device, we know how much energy we're putting in the tissue. No surprises. Safety is our ability to control that energy. And this device does this, and it does it very simply in an interface that we can change the power, we can actually set the depth, and then through F, B, and L, we can set the time. All within our control. I love control, okay? And you'll see that as I talk. But it's very, very important. And I can tell you that we've been using these devices for over 5 years, no longer, probably 2018. And knock on wood, we haven't seen an adverse event. That's a lot of treatments. One of the reasons I'm here today is that our clinic has done more treatments than any other clinic in Canada. So we have experience in this. And what I like is I don't have to manage adverse events. I don't have patients complaining. In fact, I have patients who have their treatment, walk out to the front, rebook for their next treatment without us saying anything to them. So in essence, once they have their first treatment, this device sells all the rest of the treatments because they had no problem, there's no downtime, and they see results. And that's a win-win-win. As far as the features of it is in the handpiece, remember that all the interaction between the energy and the patient becomes at the needle tip, at the handpiece, okay? So it's critically, critically important. And basically, there's several things in this handpiece that are important. The motor that actually delivers the needles to the skin is what's called a linear motor. So it does it very slowly with gradual, steady pressure. And what that does is it prevents any kickback. So meaning when those needles are inserted, we know they're at the depth that we set. That's more control. This also uses, as you can see, we can control the depth again, 0.5 to 3.5 with this device. We use a gold-plated needle. We all know from piercings and earrings that gold is biocompatible. Our body doesn't have allergic reactions to it, so that's very important. And this needle is very small. It's 300 microns. It's about a 30-gauge needle, very tiny. And we have 25 of those to use. So the needle tips, which is the interface between energy and our target tissue, is exquisite. And then the handpiece, for any of you that used it, it's very light, it's easy to use, it's not heavy, you don't get hand fatigue, and it's well balanced. This has a continuous wave, which means the wave comes on and turns off perfectly every single time. And when it comes on underneath this wave, the height of the wave is the power, the length of the wave is the time. I told you before that those two multiplied together. In other words, the area underneath that box is the amount of energy that you're delivering. So we have control with this. And you can see this just talks about the same thing, is that when we on continuous wave, when we hit the trigger, the energy for a very short period of time, 100 to 300 milliseconds, it actually rises, it peaks around 55 to 60 and then drops very quickly. Well, we know from our lasers that's important, right? We don't want prolonged heat energy in the tissue. We want it to come and go so the tissue can recover. The reason these needles are so good, and Dr. Na understood the importance of this, that they actually built robotic equipment to make these needles. And what does that mean? Well, that simply means robots do the same thing over and over. They don't get tired, they don't make mistakes, they don't take a cell phone call in the middle of what they're doing. And so you get reliability and consistency. So you can take that next head and put it on and you know it's going to behave exactly the same in this patient as it has in 500 patients that you treated before. It's critically important, and it's something that they covered. How we generate that wave energy is very, very important. And so basically the generator that they use is very pure, it's very clean. You notice that you get no tips or peaks above where you're expected. So there's no surprises, you don't get any sudden hot spots. Because in the body, we can see from the temperature grade that a hot spot causes damage. So this is the video, and if we could start the first video, that would be great. Beautiful. All I want you to watch here is watch the handpiece on the skin. It's pushed on the skin, it doesn't move, okay? So there's no what we call pushback. Why is pushback bad? Well, pushback's bad because the needles now come up out of the dermis and into the epidermis, and once you hit that pedal, the energy's going. Well, the energy's in the epidermis. We don't want it there, and that's what a pushback will do. If we could show the last video, that would be great. Other companies use what's called a solenoid, and all I want you to do is watch the surface of the skin, and you see how the device pushes back a little bit. We know that in aesthetic medicine. I mean, we see that, and that pushback, again, can cause more side effects. Side effects create adverse events, and then reduce safety, and it means I'm getting calls from unhappy patients, and that means Keith has no control in his life. And that's the way I view everything. If we understand it and keep it simple and repeat it, life is good. Our ROI goes up, our safety is good, and our efficiency goes up. A lot of clinical trials, as I mentioned. I've gone through a number of these papers. They're very well-written papers, and that's important for us as well. It's been studied. We don't have to just believe the company or believe who's selling us. Our peers have looked at this all around the world and used it around the world. And you know what we're like. If we can find a problem in it, we'll find the problem in it. And we'll tell all our colleagues the problem in it, not with this device. So this device is excellent for skin rejuvenation, tightening, and lifting. Treating scars, it's amazing for treating scars. You're going to see lots of examples of both of these. The cool thing is you can treat it on all skin types. RF energy does not see color. Treats all tissue the same, and you can treat it both on face and body. So you see that we have a huge versatility here, which means we have a lot of solutions. And we all have therapeutically curious minds, right? We see a patient, we want to solve their problem. We may not have the modality to do it, so we think, okay? We think about how are we going to use what we know and logic to solve this problem. And if we have a device that we know is safe, which this device is, and we know exactly where we're putting this energy of this device, all of a sudden we can let our minds go and we can try this safely on patients, even if it's a treatment that you haven't heard about in even one of these events. You literally can create, if you will, and invent your own treatments with this device, and I've done it. Again, versatility. So remember, what we're looking at, our target tissue is the dermis. And just to remember why, well, it's really simple. If you look at the full thickness of the skin, the epidermis is maybe, it varies throughout the body, maybe 5% of that. So 95% of it is the dermis. And if we look at this animation of the dermis, we can see all the target tissues that we want to see. We see the sebaceous gland. We know how that's involved in acne, and then ultimately acne scarring, and pores. We see vessels, and we know that when those vessels actually become pathologic, dilated, that they no longer contract, we get telangiectasia and rosacea. So vessels are a target. We see sweat glands, and that's another target, and this device will work in hyperhidrosis. We see hair follicles, and that's another, you'll learn later today, indirect target, right? We can hit that with energy, and we can release cytokines, which actually cause repair and growth. It's very cool. And so you can go down this list and see that we've got like a dozen different treatments from this one device, which means we now have multiple solutions for our patients' problems. And I think that's incredibly cool. So what does a treatment look like? Well, this is Dr. Na, and what I'm showing you here is he's doing a treatment, and I'm going to tell you in advance, this entire treatment that I'm going to show you pictorially took 35 minutes. That's pretty cool. And he treated 4 different areas. He treated the face, he treated the neck, he treated the upper and lower eyelids, and he treated the scalp for lifting. And you'll learn the technique of using vectors in the scalp to create lifting in the forehead. That took 35 minutes, 1,200 pulses. So when it comes to clinical results, and you'll see lots of examples of this today, basically he did 1,200 pulses, and what that meant that he did 30,000 targeted energy punctures, 30,000 in 35 minutes. And he treated 4 regions. So this means this device makes the provider very happy, okay? I can treat it quickly. I can treat a lot of areas. Every area I treat means more revenue to me. Every area I treat means another problem, in this case 4 problems solved for the patient. And here's the patient 30 minutes later. Now I want to remind you, this is Fitzpatrick 1-2. These people, if you look at them the wrong way, their skin will turn red. 30 minutes later, there's no bleeding, there's no bruising, there's no downtime. This is a happy patient. So we have a happy provider and we have a happy patient. Now you see why I love this device, okay? My favorite device, I'm here speaking about it, not because anybody asked me to or told me to, it's because I believe in this device. I believe it's good for our patients. I believe it's even better for all of us here in this room, and I want to share that. I have nothing negative to say about it, and I want to share that. So thank you very much. I don't know if we're doing questions now or if we're doing them later, but I can take some questions if there is any now, or we can move on to the next talk. I want to thank you very much, and I will see you again a little later today, and we'll talk about one of my favorite treatment areas, and thank you very much.